Hey, you are listening to Medica Talks, which brings to you all the exclusive healthcare industry news, views, and opinions from across the world.
Hello listeners, I'm Urvashi. Today we will talk about the issues related to changes in lifestyle and how a heart attack can be avoided by Indian population.
Hello Dr. Rakesh. Welcome to another podcast for patients, caregivers and healthcare professionals at Medica Talks.
Can you give us insights about what are cardiac diseases and what are the symptoms?
Cardiovascular diseases are group of disorders or diseases of the heart and its blood vessels. When we say its blood vessels, it means the blood vessels which is supplying the heart. Disease is caused when the blood vessels which are supplying the heart becomes narrow over a period of time and at one time there is complete occlusion which leads to heart attack. So if we summarize, heart attacks which is related to heart and stroke which is related to brain are usually acute events which happen because of long standing diseases which narrows or blocks these vessels which are supplying heart and brain individually. The most commonest reason for these kind of narrowing or blockages of the vessels or blockages of the artery is deposition of unhealthy fat on the inner walls of the blood vessels. Whereas if you understand brain related disease, that is stroke can also be produced because of the bleeding from the blood vessels within the brain, which leads to clot formation, and this clot keeps on growing in the brain and leading to stroke or paralysis. Many of the time these diseases are silent. That's why they are also known as silent killer. A heart attack or a stroke may be the first sign where you will discover the disease of the arteries or the diseases of the blood vessels which are supplying the heart and the brain. Major symptoms of the heart attack for diagnosis includes pain or discomfort around the chest area or the center of the chest. This pain or discomfort may also radiate or may travel to the arms, and specifically the left arm, left shoulder or left elbow. Many a times the pain may also travel to the jaw or back. There may be difficulty in breathing or shortness of breath where the person is not able to walk or feels that the person is not able to take enough air. There is nausea and vomiting associated with heart attacks, and many a times patient also complains of fainting or giddiness. Sweating is another symptom, and many a times you feel the person is turned completely pale because of the drop in the blood pressure.
So, what are the symptoms of cardiovascular diseases?
The most common symptom of stroke, which is the disease of the brain, where there is a narrowing of the vessels which is supplying the brain, will lead to weakness or paralysis of either a particular part of the body or one side of the body, that is known as hemiparesis or hemiplegia. If it is hemiplegia, means there is complete loss of the power of that particular side of the body. So that will be one-sided paralysis.
Why are cardiovascular diseases a development issue in low and middle income countries?
Many a times it has been seen that people who are living in a low and middle income countries often get these symptoms of heart diseases or stroke or the diseases of the brain. It is not that the incidences are too high in this country, but many a times in low income country or a middle income country, the financial capacity of the individuals are very less. So because of which they are not able to do detection of these diseases on time because of the financial issues, they may not get themselves investigated, which will pick up or which will diagnose these diseases before they progress to a fatal conclusion or before they progress to a terminal stage. So many a times there are screening tests which are required, like say example in cases of heart we may require ECG, we may require 2D echo evaluation, or may require a angiography. But because of the financial incapacity, these investigations are not done. Even if there are facilities around, the patients are little reluctant because of the money involved. And many a times, if the rural population, the medical healthcare facilities are not around, so they end up bearing the symptoms. Even if they get symptoms, they start bearing those symptoms, and they don't reach for help from the medical fraternity. So these are the various reasons because of which there is delay in the diagnosis, and eventually the disease progress to an end stage, or may progress to a stage where the person lands up with heart attack.
What steps or changes should one take to lead a healthy life and avoid CVDs?
The diseases related to heart and say diseases related to brain, they are one of the leading cause of death all around the world, and it is often associated with various comorbidities such as obesity, diabetes, high cholesterol, high lipid levels, and hypertension, etc., etc. So lifestyle is very important, and the quality of lifestyle becomes the best defense against the development of the heart diseases and stroke. So it becomes an individual responsibility to look after one's own lifestyle. So lifestyle modification becomes a very important thing when we are dealing with person who is having heart disease, or person who is developing some kind of brain disease due to lack of blood supply to the brain. A healthy heart lifestyle includes various things, and there are various simple steps which are involved, and there are certain risk factors which can be modified so that the heart can be preserved and the person doesn't land up with heart attack, or in future doesn't land up with some other diseases which is leading to development of the brain stroke. So first of all, if a person is smoking, the person has to stop smoking. Stopping the habit of smoking can result in a dramatic reduction in the inflammation of the vessels, and the person may start feeling the difference after the person quits smoking. Choosing good nutritional value supply to the body by just following the simple dietary pattern, which is known as dietary approach to stop hypertension, that is known as DASH diet. The DASH diet is specifically designed so that the person's blood pressure can be reduced and it can be brought to the normal level. It usually comprises of eating fruits, vegetables, whole grains, low fat dairy products, legumes, nuts, seeds, and lean meat. These foods are typically high in fiber and low in saturated fat and low in cholesterol and low in sodium. So according to the research which has been conducted, the DASH diet can lower this systolic blood pressure by at least 8 to 10 millimeter mercury and diastolic blood pressure by 4 to 6 millimeter of mercury. By doing this, we are reducing the mortality. High blood cholesterol level, like adding saturated fat in the diet and replacing the saturated fat with polyunsaturated fat, may lower the cardiovascular risk. This means by just simply replacing butter, coconut oil, palm oil, and other things with certain simple replacements like olives, safflower, corn, sesame soya bean and sunflower oil. These are the various oils which will reduce the fat content, and unhealthy fat can be brought under control. So the diet which is rich in fruits, vegetables, nuts, seeds and whole grain, with limited consumption of very oily and fatty stuff like red meat and sweets and all, can cut down the risk factor to a very considerable level, and we can prevent the heart from getting into a zone of heart attack. Olive oil is supposedly the main source of dietary fat, and it is rich in omega-3 fatty acids. Lowering the high blood pressure will eventually reduce the load on the heart, and it keeps the heart healthy. On the other hand, physical activity is also must. For all adult individuals who are between the age of 18 to 64 should engage in at least 30 minutes of moderate aerobic exercises per day. Say activities like brisk walking, running, swimming, and other exercises which is like jogging, or other exercises like cycling and all, can also help in keeping the person physically active and reducing the unhealthy fatty deposition all over the body, especially in the blood vessels. Controlling the weight is another important thing which can be achieved by doing these simple exercises. And very important thing is reducing stress. Some people need to learn various techniques to cope up with stress, because stress is one factor which will activate the stress hormones in the body and stress enzymes in the body, like what we say epinephrine, norepinephrine, adrenaline and various other things, which will invite some form of other diseases like hypertension and diabetes to set in that particular individual, which will speeden up the process of narrowing of the blood vessels, and ultimately the person may land up with heart attack, or there will be a brain attack which is known as stroke.
What message would you like to give to the society for maintaining a good, healthy life?
High blood pressure and high cholesterol can damage the heart and blood vessels, and if you don't test, you are actually risking your life, and there are high chances that you may end up with a serious kind of a heart attack. So that's why regular screening is much more important in order to take relevant action on time. Blood pressure should be measured once the person crosses age of 30 years, and should be measured at least once in 6 to 8 months to see whether the pressure is under check. If you have high blood pressure, then one should get yourself screened. When I say screened, I mean certain sets of investigations which need to be repeated once in a year or once in 1.5 years, so that we come to know that what is the status of the body. The cholesterol levels, especially the adults, should undergo cholesterol checking once in at least 2 to 3 years, so that we know whether the cholesterol levels are under control. And many a times individuals who have got a family history of hypertension, obesity, diabetes, all these individuals should undergo screening of their blood test every 1 or 2 year. The simple test like doing a lipid level or the cholesterol level or the triglyceride level, or many a times doing a regular ECGs once in 2 years if there are any changes in the ECG, and checking their blood pressure at the OPD level. These are various things which can be done. Type 2 diabetes screening is also mandatory, because diabetes is a high risk factor for the development of the narrowing of the blood vessels, and eventually which leads to heart attack. So the screening of diabetes is also important, and we need to keep our weight under check so that we don't develop an insulin resistance, and eventually there is a pancreatic cell failure leading to diabetes. So people who have got a family history of diabetes needs to be extra careful and get themselves checked at early stages before they land up with a very high diabetic levels. and irreversible changes in the heart. If you have some clinical conditions such as high cholesterol, high blood pressure, or diabetes, you should keep a check. You can simply keep a check on your own sugar levels or your pressure levels by by buying certain screening devices which will help you to keep a check on these parameters at a regular interval. And these screening devices are actually available on the platform like Medikabazaar, which will help you to assist you or help you to keep a check on what is the condition of your pressure or fluctuation in the pressure, or what is the fluctuation in your sugar levels or the blood sugar levels. So these are simple devices like getting a glucometer, or if you are a diabetic, you may need regular insulin or anything. So all these products are available on this platform. Many a times you may require a blood pressure monitoring device, which is also available. It has been seen that blood pressure fluctuates at different time of the day. When you are exhausted, the blood pressure is different. When you have rested, the blood pressure is different. So then these monitoring devices are easily available on this platform of Medikabazaar. So another important thing is like a glucometer, which will keep a check on your blood sugar levels. So that is also very important, and nowadays it can be easily done at home. Just a matter of prick and the sugar levels are understood. So this is very important, especially in diabetic patient, because diabetes, sometimes the sugar may be high, and if the medicines have been taken without sufficient intake of food, it may go as low as leading to giddiness and loss of orientation. So the glucometer is mandatory, which is available on this platform. So thanks a lot for a patient listening. I hope this talk will enhance the awareness amongst all of us to fight against a dreaded disease like heart diseases or heart attacks, and we are more oriented and more appropriately behaved, so that we avoid ourselves from getting into this zone. Thanks a lot.
Hey listeners, I hope this podcast was beneficial for you. Don't forget to stay tuned with us for our next podcast session, where we bring to you all kinds of healthcare industry news, views and opinions from around the world.